Let me ask you something personal. When did you last feel genuinely strong? Not just okay, not just managing. Strong, clear, like yourself. If you're taking a statin medication, something your doctor prescribed to protect your heart, I need you to stay with me for the next 10 minutes. Because that pill is doing its job. It is lowering your cholesterol. The research on that is real. But there is something happening inside your body right now. Something that begins the morning you take your first dose that almost nobody is telling you about. By the end of this video, you'll know exactly what that is. You'll know why your symptoms are not just aging. And you'll have 3 specific foods, things you can buy today that begin giving it back. Before I tell you what's being depleted, I want you to do something. Think back to when you started your medication. And ask yourself honestly, are your legs heavier than they used to be? Do you run out of energy, not at the end of the day, but right in the middle of it? Do your thighs or calves ache for no reason? No injury. Nothing you did. They just ache. If you nodded at any of those, I want you to know something important. That is not aging. In 2023, a major study published in JAMA Cardiology found that roughly 1 in 3 people who start statins report significant muscle symptoms, 1 in 3, and 13% stop taking their medication entirely because of it, not because the drug stopped working, because their body was telling them something was wrong. The question is, what? Here's what's happening inside you right now, explained simply. Your liver has a biological production line. Scientists call it the mevalonate pathway. Think of it as a road that runs through your liver every single day. On this road, your body produces 2 things. Exit 1, cholesterol. Exit 2, CoQ10, coenzyme Q10. When you take a statin, it blocks the enzyme that runs this road. That reduces cholesterol. That's the goal. That's why it works. But here's what most people are never told. The road is also closed to CoQ10. CoQ10 is the fuel your mitochondria use to generate energy in every single cell in your body. Your heart muscle, your leg muscles, your brain. They all run on CoQ10 the way a car runs on petrol. When CoQ10 drops, your cells don't have enough fuel to fire properly. And they tell you in the language of fatigue, of aching, of weakness, of feeling 60 years old inside a body that used to feel 40. Now here is the part that should make you sit up. Studies show statins can reduce your circulating CoQ10 levels by 30 to 40%. Not 5, not 10, 30 to 40%. Imagine your phone battery going from full charge to 60% permanently. That's what some statin users are living with every single day, and almost nobody is testing for it. But before I tell you what to do, I need to tell you about a patient of mine. Because her story is the reason I made this video. Her name was Diane, 64 years old, retired school teacher. She'd spent 40 years on her feet, corridors, classrooms, sports days, school trips. She was the kind of woman who organized everything, who never stopped moving. Her garden was her proudest achievement. Dahlias she'd been growing for 12 years. She showed me a photo on her first visit. 11 varieties, all labeled with little wooden sticks. She'd painted herself. 19 months after starting her statin, the garden had gone to weeds. She didn't tell me that to be dramatic. She told me because she thought it was her fault, that she'd become lazy. That age had finally caught up with her. She said, I feel like someone switched off a switch inside me. I wake up already tired. My legs ache by 10 in the morning. I keep waiting to feel normal again. 2 doctors before me had said the same thing. This is just what happens after 60, Diane. I ran her blood work, and I looked for something the others hadn't looked for. Her CoQ10 levels were critically depleted. We didn't change her statin. We didn't add a new drug. We changed what she ate. 6 weeks later, she sent me a photograph. Dahlias. All 11 varieties. a new wooden stick in her hand, still wet with paint. She wrote 3 words underneath, "I'm back. Thank you." Now here's why this matters for you. CoQ10 is not a standard blood test. Most doctors are not checking it. Not because they don't care. Because they were never taught to look. Which means, if this is happening to you right now, nobody is catching it. Until now. Now, I know what some of you are thinking. Can I just take a CoQ10 supplement and fix this? Honest answer, maybe. The research is genuinely mixed. A 2025 meta-analysis in the Journal of Nutritional Science looked at 7 randomized controlled trials involving 389 patients. They found a statistically significant reduction in muscle pain with CoQ10 supplementation. But other reviews, including analysis from major cardiac centers, found no clear benefit in all patients. Both are right. Both are looking at the same data differently. Here is my position. After years in clinical practice, food first, always. Because certain foods don't just contain CoQ10, they contain the cofactors that help your body actually absorb and use it. No supplement can replicate that synergy. And before I give you those foods, I need to ask you to check something. Because knowing you're depleted is one thing. Knowing how to recognize it in your own body, in your own life, that's the real tool. Here are 5 warning signs that your CoQ10 may be critically low. Count how many apply to you. Be honest with yourself. Warning sign number 1. Unexplained muscle aching, especially in your thighs and calves. Not from exercise, not from injury. A dull, constant ache that's just always there. After 60, on a statin, this is the most common sign there is. Warning sign number 2. Energy that collapses in the early afternoon. Not normal tiredness. Collapse. You're fine in the morning, then it's like someone pulled a plug. CoQ10 powers your mitochondria. When levels drop, your cells stop generating energy efficiently. That collapse is biological. It is not laziness. It is not your fault. Warning sign number 3. Difficulty climbing stairs or getting up from a low chair. Leg muscles are the most energy-hungry muscles in your body. When CoQ10 is low, they're the first to feel it and the slowest to recover. Warning sign number 4. Brain fog. Slow thinking, forgetting words mid-sentence. Your brain runs on mitochondria too. In fact, neurons have more mitochondria than almost any other cell. Low CoQ10 doesn't just drain your legs, it drains the organ that makes you, you. Warning sign number 5. Shortness of breath during mild activity. Walking to the kitchen. Climbing half a flight of stairs. Your heart is the most energy-demanding muscle in your body. It never stops. Not once. Every day of your life. When CoQ10 drops, your heart is working harder for less. If 3 or more of those sounded like you, please do not dismiss them as aging. They are a message. And I want to make sure you have everything you need to answer it. All right. Here are the 3 foods. Food number 1, sardines. I'm starting here because this is the most practical, the most affordable, and the one most people can act on today. Sardines are among the richest sources of CoQ10 in the entire food supply, roughly 6 milligrams per 100 grams. They're also loaded with omega-3 fatty acids, and here's the important part most people miss. CoQ10 is fat-soluble. It requires dietary fat to be absorbed properly. Sardines deliver both in one tin, twice a week, on whole grain crackers with a squeeze of lemon. Cost about $2 a serving. Diane started here. Food number 2, beef heart. I know, stay with me. Gram for gram, beef heart is one of the single highest natural sources of CoQ10 on the planet, around 11 milligrams per 100 grams. That's roughly 3 to 4 times what you'd get from regular beef. If organ meat is outside your comfort zone, that's completely fine. Sardines alone will get you a long way. But if you're open to trying it once a week, even small amounts make a meaningful difference. Food number 3, cooked spinach with olive oil. And this one comes with a critical detail most people never hear. Raw spinach contains compounds called oxalates. Oxalates bind to minerals and block absorption. So if you're eating raw spinach in a salad thinking you're maximizing nutrients, you're actually absorbing less than you think. Saute it. 3 minutes in olive oil. The heat breaks down the oxalates. The olive oil activates the fat-soluble nutrients. And the magnesium in spinach? Your mitochondria need magnesium to actually convert CoQ10 into usable energy. These 3 foods work together, not just to restore CoQ10, but to restore the entire energy system your cells depend on. I want to say something to you before we finish. I am not against statins. Statins have saved millions of lives. The evidence is overwhelming. If your doctor prescribed one, it was almost certainly the right call, but a pill that protects your heart should not quietly drain your legs, your energy, and your mind in the process. You deserve to know what's happening inside you. You deserve to walk into your doctor's office and say, "I'd like to discuss my CoQ10 levels." Here's why. That is not being difficult. That is being your own best advocate. This week, I want you to do 3 small things. Add sardines twice. Make cooked spinach with olive oil. And ask your doctor about testing your CoQ10. Small changes. Real results. Diane got her garden back. Your body is not broken. It just needed the right information. And now, you have it. Before you go, I have to tell you one more thing. Statins are not the only medication doing this. There are 6 other common prescriptions, drugs millions of people over 60 take every single day, that are quietly depleting different critical nutrients from your body. One of them depletes a nutrient so essential to brain function that when it runs low, the symptoms are nearly identical to early-stage Alzheimer's disease. Not aging. Not Alzheimer's. A nutrient deficiency. One that is completely reversible if you catch it in time. In my next video, I'm going to walk you through all 6. And exactly what to eat to protect yourself from each one. If you don't want to miss that, subscribe now and hit the notification bell. That video could change how you look at every pill in your medicine cabinet.